ADHD is actually it stands for Attention Deficit Hyperactivity Disorder. It's probably, after anxiety and depression, the most common mental health disorder that we deal with. It has to do with some basic core symptoms of inattentiveness, impulsiveness, and hyperactivity. But it's more than that. It also has to have impairment in at least two domains, home, school, other situations. It can't just be your kid that's running around. It has to significantly impair their ability to function in these different environments. There are three main subtypes of ADHD. There's the inattentive type, there's the hyperactive type, which most people are familiar with, but inattentive is probably more common, and then there are kids with both, combined type ADHD. We usually like to have families work with behavioral interventions first. There are a lot of things that a family can do and a school can do to help kids with ADHD. Structure is extremely important. Kids with attention deficit problems are easily distracted, and so having routines and structures, minimal distractions is extremely important. If we've tried behavior interventions, we've tried to work with their environment, and the child still seems to struggle, medication then becomes the next step typically, if nothing else is making a difference. There are several kinds of medications now. Most people are familiar with the stimulant kind of medications. They really are the most effective. They work very quickly, but they have side effects sometimes, and that's the rub. And you have to figure out, do the great advances and changes that happens in your child and the positive things, is it worth it to put up with sometimes the side effects? The side effects typically are appetite suppression, trouble sleeping, and sometimes they'll have what we call a rebound, where the kids, as the medicine wears off, they tend to get a little more agitated. But if these medications are monitored carefully, started at a low dose and worked their way up, they are very safe, and they can be a miracle in kids' lives. Other medications that are not stimulants, medicines such as Strattera, Intuitive, Guanfacine, there are several of them. They don't have the same side effects, but they probably aren't as robust as the stimulants. The first thing they need to know is that these medications don't make them smarter. What the medication does is help the child focus, stay on track. The child still needs time to learn. They still need to take the time to read and do all the fundamentals. There's no shortcuts here. The medication simply helps a child get back on track. My experience has been there's probably three different groups. There are kids who find that the medication helps them, and as they start to mature, junior high, high school, they seem to outgrow the need. The other parts of the brain seem to take over. They just seem to do better, and it probably has a lot to do with maturing. A second group of people struggle, but they change what they do later in life. They find that they can't function in a classroom setting. They're not going to get a job where they're sitting in another desk for the next 20, 30 years. They learn to do things with their hands. They're active. They're outdoor skills. They learn that they have other skills, and they take advantage of those skills. And then there are people who really struggle their entire life, and medication is something they need to have the rest of their life. There's a lot of stigma associated with ADHD, and I think it's important that families and individuals worried about this consider the medical model that we use for lots of diseases, such as diabetes. With diabetes, you try to help people exercise, eat properly, but often they need insulin. And there's no stigma associated with taking insulin. You take it, you function, and life goes on. Kids with ADHD have a similar problem, but it's in their brain. There are chemicals missing or depleted, neurons needing to be connected that help you focus. And without those chemicals, you struggle. And the medication for ADHD, we understand, does the same thing. It helps connect those neurons, makes a difference with their ability to focus, stay on tasks, help with their impulsiveness, makes all the difference in the world in their lives. The family has to be engaged. There are things that are extremely important that a family does in their home and their lifestyle and getting along and so on. And the most important thing is education. Parents need to be willing to get educated, to learn all of the nuances and the challenges with ADHD. If they're expecting a pill to fix their problem and move on, it's not going to work. Parents need to understand that we're here to help them, and it's not a quick little thing.